So my name is Paul Boy. I'm a first-year PhD student at the School of Nursing. And my area of interest is on the phenomenon of burnout among healthcare workers, especially nurse practitioners. So I worked for about 8 years as a nurse, as a bedside nurse, and that includes like cardiac tele units, same-day surgery, post-anesthesia, and also medical ICU. I worked 8 years as in the community health hospitals in Arcadia and Pasadena. Occupational and environmental health really was sort of intrigued me, especially that it focuses on the sort of the promotion and restoration of health for the workers, and especially for healthcare workers. Like I've seen how nurses work and other healthcare workers as well, and so it sort of motivated me to look more into it and see what I can bring into the table. Especially with the pandemic, it really inspired me to really look more into the occupational system that can help healthcare workers. And also the other thing is that it also sheds light on the importance of well-being and prevention of injury for healthcare workers. And so it also motivated me to look into it and see what I can bring to the table. So as a NIOSH trainee here at the School of Nursing, exposed and privileged to learn the different interdisciplinary occupational health and safety practices and sort of collaborate with others during that process. We participate in these seminar discussions in various topics that affect essentially the well-being of the worker. We get exposed to different health practices, health situations, collaborate with other health individuals that are also learning like me. And, we use evidence-based practices. We look at scenarios and try to see what we understand of the situation, create plans, and hopefully give solutions through new innovations. So one of the good things about my experience so far is the faculty. They're very accessible. They're very supportive. I also like that I'm able to interact not only with the other professors and other faculty, but with also other fellow trainees and fellow students from industrial hygiene and from other public health disciplines. And so it's nice to be able to hear their perspective and also sort of have my input from the nurse's perspective. And so I really like that we were able to collaborate, especially during the seminars, and learn new things and meet new people. So with occupational health, it's one of those things that as far as nurses, they usually forget that they need to also look out for their own well-being, for their own safety. And well-being encompasses not only the physical health, but also the mental health, psychological health, and essentially their own personal well-being. And if they can take care of their own personal well-being, then they can take care of their patients safely and their families as well. So, especially with the current pandemic, it really showed how nurses, fought through the pandemic day in and day out. We are there in the front lines helping patients. And so now it's sort of my way to sort of give back and try to see and help what changes are needed. And that way we can be prepared if we face a similar pandemic in the future. I chose UCLA because I was a former student in the Master's of Student Nursing, and I know how their approaches to research and innovation. They lead not only local and state innovations that have helped shape not only nursing, but also the public health, but also nationally and internationally. The faculty are world-renowned, and as someone who works in UCLA, I have seen the growth that a student can have. And so there's no question of me going back to my home school. As you know, UCLA has world-renowned faculty. Their training is impeccable. Not only will you learn a lot, but you will gain knowledge that will stay with you through your life. So just enjoy and learn the process. It's going to be hard, but it will have rewards. Just keep an open mind and a wide gaze and learning from the experts and collaborating with students and other faculty. I think that the knowledge you will gain will be measurable and will be important because it will also shape the future of OC health. I just feel like that the UCLA has impressed on me the importance of occupational and environmental health. The safety and the well-being of the worker is as important as patients and anything else. And so the training I'm currently having and the approaches to research and innovations that are being put forth by the school is very impressive. And, you know, it really inspires me to hopefully I can also do something similar to that.